Hi, it's Douglas here with a quick introduction to some of the critical appraisal concepts we'll need to bear in mind when we're looking at our cohort study on adolescent gender diversity. This is a longitudinal cohort study of all children born between 2002 and 2006 based in the Rotterdam in the Netherlands. And I've just showed you where on the paper these details can be pulled out. They were assessed for this study at ages 9 to 11 and again at 13 to 15. So what measurements were taken? So the researchers were interested in this case in gender diverse experience, and they had two different questionnaire items that looked at that. And in terms of outcomes, we were looking at mental health symptoms across a number of different domains in quite a detailed questionnaire. They also looked at autistic traits and looked at the socio-economic background. But for our purposes, we're interested in most in the relationship between these two variables. I think an important aspect of the study to pick up is that the instruments that they used, rather the questions that they used to assess gender diverse experience, and this was defined very simply as any response to two or three or to one of these two questions. So would you rather be treated as someone from the opposite sex? No, probably yes, or definitely yes. And similarly with the ACEBA question. So I think there's probably a useful discussion to be had around what other measures might be helpful to understand the diversity of experience and also the timings at which people's feelings might change over time. So in appraising the paper, we very often use this framework by the Critical Appraisal Skills Programme, and this presents you with a checklist of questions just to remind you of the kind of things you need to look for when we're trying to assess whether the bias could have affected these findings. Now, helpfully, I've filled in these with my opinions, and there may be other views out there. And so you can see on initial glance, it's a bit of a mixed picture. But I wanted to point out that under question 5, have the authors identified all important confounding factors? Well, by the nature of this type of study, that's not possible. Because of the complexity of it, and we were just looking at these two variables. But it would be helpful to have more measurements and over a longer period of time, so that we could understand more about how people's gender experience might change through those crucial years, from age 9 onwards. However, when we look at the results, the findings of the study were around 4.3% of the participants met that criterion, and the prevalence, if you like, was about double with people assigned female sex at birth compared with those assigned male. What we've seen is consistent, moderate positive associations between gender variant experience and mental health symptoms. And what that means is that the more people had experienced some sort of gender variant experience, they were more likely to also have mental health symptoms. There was also an association with autistic traits from the parent reports. And one of the interesting findings was that when the researchers looked at self-reports from young people, the association was even stronger. Self-reports as opposed to reports by their parents. And finally, I think one of the interesting things was that there was the absence of any clear evidence of a link with socio-demographic characteristics. So in summary, there was some very useful information provided by this study. We have a large sample attempting to get the whole population, and we're using validated mental health outcomes. The findings are very much consistent with the small number of similar studies. And while we might have concerns about who takes part and who drops out of these studies, in the context of population cohort studies, this is a good follow-up. And perhaps the main limitation is more a recommendation for future research, thinking about how do we represent the range of gender diverse experience and when, if we're wanting to better understand how to support people. So here's my conclusion. I felt overall this was a well-conducted population cohort study. We found the broad prevalence of any gender diverse experience was about 4.3%. And those experiences were associated with more mental health symptoms. Future research needs to address how we understand, how researchers represent and understand the diversity of that experience and how it evolves over time. So I'll pass you back now to the campfire, and we can continue with the discussion. Thanks for listening.